Hello, everyone. My name is Samantha Frank, and I'm going to present my business proposal for Gallup Indian Medical Center on a problem that is affecting the ED. What is the problem for Gallup Indian Medical Center Emergency Department? Well, the patient wait times for JMC are too long. It is important that we treat and care for as many patients as possible. Looking at these charts, we see that in January 2018, the total number of hours was 4,828 hours. This means that an average stay lasted around 6 hours. This is too long of a stay for the patients. When we look at the data for January 2019, we see that the length of stay reduced to 4,056 hours. This was accomplished by hiring more nurses. Having more nurses meant more patients could receive treatments faster. Also, because of the wait times, the patients that left without being seen was 267 for January 2018. The wait times were too long, so patients decided to leave and not receive treatment. But comparing that to January 2019, we see that the number reduced to 87 patients, leaving without being seen. These are great improvements that the ED has accomplished. But how did they accomplish these problems? Well, first, as I said, they hired more nurses. Having more nurses meant that more patients could receive their treatment from the hospital. Even though the problem has been resolved, we want to continue to improve the wait times for the emergency department. So the next a solution that I have thought of is going to be in the next slide. But first we're going to look at who does the problem affect. Well, the problem affects 4 areas of the hospital. First, it affects the patients, the providers, the nurses, and Gallup Indian Medical Center itself. The patients are the ones that are affected the most because they are the ones who travel to GIMC, because they are the ones traveling from many parts of the Navajo Reservation and Zuni Reservation, and also even the Hopi Reservation. So we want to be able to treat as many patients as possible. By not putting the patients first, we lose the main goal of our facility, which is healthcare. By improving the wait times, we will be able to provide the utmost care to the Native Americans surrounding the Gallup area. As I said, the problem also affects the providers and nurses. By not keeping the flow of patients going, the providers and nurses have to care for the same patients for 2 or 3 hours, meaning that less patients are being seen because of these long wait times. Reducing the wait times will allow the patients to be seen faster and to bring in more patients. Lastly, the problem affects GIMC, especially the profits for the emergency department. As we see from this chart, in January 2018, the profit that was brought in was only $23,800. This is partly due to the patients that left without being seen. When they decide to leave before being seen, we lose out on receiving payment. So the more patients that we have that are leaving without being seen affects the profits that we bring into the emergency department. So because in 2018 we had 267 patients leave the waiting room, which resulted in a profit of $23,800 for the month of January. But as the previous changes that I have mentioned, because of the nursing management of the emergency department, the number was brought down to 87 in January 2019, which affected the profits for that month. Instead of losing money, the emergency department was able to earn $97,300. As I said before, earning profits helps the emergency department and GIMC because it helps pay for the facility, equipment, and treatments the patients will receive. Without the profits, the hospital will not be able to run properly, meaning the patients don't receive the correct health care that they need. After conducting some research, I have found 4 possible solutions that could help reduce the wait times at the ED. Looking at this graph, we are able to look at the 4 possible solutions. The first one is introducing a flow nurse coordinator. This nurse would be in charge of taking care of the patients who need to be transported either to a different unit of the hospital, which is GIMC, or the patient needs to be transferred to a new hospital facility altogether. The nurse will only take care of these patients that are waiting for transportation. However, this does reduce the number of nurses that are treating patients. The next solution would be to replace the on-call doctor with a doctor that is there for the entire shift. The ER will be able to have an extra provider in the emergency department rather than having the provider at home waiting for a call that he or she may not receive. But I don't believe that a provider will want to work another shift. I think they would rather just want to be waiting for that call that they may not receive. The next solution is to staff when needed. This means that during high patient times, there will be more nurses and more providers. But having more of these means that GIMC needs to make more room in the emergency department, which is not really a possibility as of right now. So the solution that we plan to go with is to designate a doctor to triage patients instead of a nurse. It is common practice that to have a triage nurse do the triaging of the patients, but I chose this solution because it was cost effective and the patients may like seeing a provider rather than a nurse when they first get checked into the the emergency department. The way this solution is cost effective is that the providers are already available, so there is no need to hire new providers for this position. Another thing is that it will bring back the triage nurse back into the emergency department where she will be able to provide the treatment that a patient may need. Also, the provider will be able to determine if a patient needs to be seen right away, such as if they are having a heart attack or a stroke. They will be able to be seen, they will be able to get a bed right away into the emergency department. It does sound like a difficult transition from changing the triage from a nurse to a provider, but it will have a more positive impact to the patients at GIMC. So, how will this solution be implemented? Well, the first step is to have 2 separate meetings with the providers and nurses. By having these meetings, it will allow us to explain why the solution is being implemented and how we plan on implementing it. We will also give the chance for our nurses and providers to ask any questions they may have or to voice their concerns they may have about the solution, because this is a new change that we're making them do. So we don't want to just force this upon them. We want to, get their feedback about what they think about the solution and if there's any way that the solution can be improved on or how they feel about it. Next, we want to ask for volunteers to start this journey. We don't want to force our providers, to do something that they don't really want to do. So we're going to ask for at least 4 providers to see if they are willing to help us with this solution. We hope that by the end of the year, we will be able to have all providers being triage providers for our emergency department. The next step would be to have the 4 providers be trained during the night shift. This is because night shift tends to be less busy, so the nurse will be able to be more one-on-one with the provider as they train them on how to conduct the triage with the patient. We want to continue this for about 2 months before we transition them to a day shift where it can be a little bit more chaotic and busy. Within the 6 months of starting this solution, we want to have all 4 providers be able to transition between night and day shifts, so that they can experience both shifts and see how they feel. Once we get that feedback, we can determine if they are more comfortable with day shift or night shift and schedule them accordingly. Once we are ready to begin all providers for training, we will ask the 4 providers for feedback to fix any issues that may have occurred or any other problems that they see with conducting a triage. So as I said, at the end of the year, we want to have all our providers in the emergency department be able to be providers, to be triage providers. So how will we evaluate the solution? Well, we feel that feedback will really help us to fix any issues or problems that we may have from our patients. We will ask if they like being triaged by a provider, and if it was any different from a triage done by a nurse. We will also ask them if they prefer to see a provider first rather than a nurse. And we want to know if they felt more comfortable with seeing a provider, meaning if they were able to open up more, to share more of the symptoms that they're having, because it could be different with the provider and nurse, so we want to see how that feedback is given. We will also ask the providers how they feel about the triaging experience. Some questions we could ask are how the patients reacted to seeing them in the triage room, if the patient opened up more because the provider was doing the triage. And lastly, we want to ask our nurses how they felt about this transition, because they're the ones that they already know how to do a triage, and seeing how a provider does it could be differently. There could be things to fix, things to improve on, things that maybe occurred better because it was a provider. Also, we can determine if more critical patients are being seen faster because the provider is doing the triage, such as patients that are having chest pains, and any other serious symptoms. We also want to keep track of the data from the triage that the providers provide. The data that we want to keep track of is how many patients the provider is triaging each hour. This will let us know how each provider is doing. If one provider is taking too long with each patient, then we can fix that issue by sitting down with the provider and discussing why they may take a little bit longer than other providers when conducting a triage. By continuing to monitor the situation, it will allow us to make adjustments and corrections if needed. By having a provider conduct a triage, we hope that we can reduce the wait times for the patients. And thank you very much.